Yeah, so basically for those, so you have the different serous membranes. You're going to have the one for the heart, one for the lungs, and one for the abdominal pelvic cavity. And so your parietal is always going to be, which one? The one that's closer to the organ or farther away?
Farther away.
Right. So then it would just be the visceral peritoneum, which is closest to the organs, and then the parietal, and then it's just peritoneum for the abdominal pelvic.
Okay.
Mm-hmm.
And then what about the visceral peritoneum?
So the visceral then would just be the, let's see on this picture on page 20, visceral, so it shows it right here.
Mm-hmm.
So basically, let's say we have, this is going to be rough, let's just say this is your body, okay?
Mm-hmm.
So here's your head, and this is going to be your abdominal pelvic cavity.
Right.
So you have a bunch of different organs in here, let's say, but like obviously if it's like going to be the lung, it'll be the pleura. If it's the heart, it's the pericardium. But like all your other organs that are in here, your visceral peritoneum is going to be the one right here in red. And then you'd have the cavity that surrounds it.
What organ is that?
It could be multiple ones. Like they call any of the ones outside of here. So then you have like this one that's big. These would be like your retrospective organs. The ones in here could be like your liver, your stomach, really any organ that's inside this cavity right here.
Okay.
So yeah, you have your visceral peritoneum, and then you'll have a cavity. And then this one right here, that will be your parietal peritoneum. So visceral is always closest, and parietal is always farthest away.
But it's not like that on the lungs or the heart?
So the lungs and the heart, it'll just have more specific names. So for all the other organs, it'll just be your peritoneum. But when we do the heart, we call it your pericardial.
Oh, okay.
Mm-hmm. So this one would be the visceral pericardial.
So the equivalent of the parietal peritoneum would be the parietal pleura for the lungs?
Exactly.
Oh, okay.
Mm-hmm.
Oh, that makes sense. Okay.
Yeah. Because parietal will always mean the membrane that's going to be the outside, and visceral is always going to be the membrane that's closest.
Mm-hmm.
And then for the heart and lungs, we just give them specific names.
Okay.
So yeah, there's a lot of patterns. Once you figure out the pattern, then it's like, oh, okay, I can figure that out. But if you don't know the pattern, it's a little harder.
Yeah. And then visceral peritoneum, that's just the equivalent of the visceral pleura?
Mm-hmm.
Okay.
Exactly.
Cool. On the practice test, there's also questions about, it said a bullet passes through a lung and lodges in the heart. And the answer was, and asked how many membranes did it puncture?
Mm-hmm.
The answer was 6, but I counted more than 6. I got like 8 or 10.
A bullet passes through a lung and lodges in the heart. Okay, so let's draw this out. And the answer was 6?
Yeah.
Okay, so we have our body, and let's say, so it passes through the lung, right?
Uh-huh.
So let's draw the lungs up here. And we'll draw the heart. All right, so let's draw the different cavities for the lungs first. So the lung, is that going to be the pleural or the pericardial?
What do you mean?
Like when we talk our kind of
the
pleura? Okay, so we have on the outside, we have the what?
The parietal.
Uh-huh.
Pleura. But don't we have the cavity first, the pleural cavity?
That's going to be in between the parietal and the visceral, is where the cavity is.
Oh.
Mm-hmm. So it's kind of going to be holding, these two membranes hold the cavity.
Okay, that makes sense.
Mm-hmm. So we have parietal
And the
visceral.
cavity isn't a membrane?
Right, right. So that's probably where you were counting them.
Okay.
So then we have the parietal right here, the parietal pleura, so right PP, and then we're going to have the cavity. And then what is this one right here that's closest to the membrane?
Visceral.
Right, so the visceral pleura. Okay, so it's going to pass through. If here's our bullet. And then we have the heart. So then the heart, what was the name we used for that instead of pleura, pericardium? So we have the outside one, which is going to be the
Parietal pericardium.
Pericardium. And then we have the cavity.
Uh-huh.
And which is this one right here?
The visceral pericardium.
Visceral pericardium. Okay.
Cool.
So we have 1, 2.
Wouldn't it also, it's passing through the visceral pleura, but then wouldn't it pass through the lungs as well? So that wouldn't there be like 2 right here? Because it passed through the visceral pleura and then passed through the red line.
Uh-huh. So
okay.
So the red line is just the lung. That would be like our organ.
Oh, so that's not another membrane.
Right, it's just going to be the organ.
Aha.
Mm-hmm.
Now I'm seeing where I'm getting all this.
Yeah, so it's going to pass through the parietal pleura, and then it's going to pass through the so let's put a 1 there. Passes through the visceral pleura, and then we're going to go through the lung, and then it has to go out of the lung, right?
Uh-huh.
So that's where we get our 3 when it passes through the other visceral pleura, and then we have 4,
Yeah.
other one, and then we go through the, which membrane was this?
The visceral.
Mhm.
No, that was the parietal pericardium.
Yeah, parietal pericardium, and then
This one's the visceral.
visceral. So that's where we get the 6.
Okay.
Does that make sense?
I feel much better.
Yeah, because you know all the information, how to get it.
Yeah.
But yeah, so the organ isn't a membrane. The membrane will just be the, kind of like when we, on page 19, we talked about the serous membranes, and it kind of has the example of if the fist is the organ, and we punch it through a balloon, the membrane that our fist would be touching would be the visceral. Then we have the cavity, and then the parietal.
Okay, yeah. Okay, I'm like scared now. I was like, what? No, this doesn't make any sense.
Like, I'm getting so many numbers. Yeah, so just the membranes
Okay.
are the only ones you're going to be counting.
Okay. Okay now. So
Perfect.
it's basically just 2 membranes to get to each organ.
Uh-huh, exactly. So what if I said, I don't even know if I can come up with one. What if the heart was over here for some random reason? What if we said the bullet passed through both lungs
Yeah.
and then looped around and hit the heart? How many would that be then?
To go through the heart?
Mm-hmm.
Okay, so
Or let's say it goes through one lung, goes to the heart, and then out the other lung.
that would be 12.
So, yeah.
Should it just be
We
twice
go
as
2,
well?
4, 6, 8, 10, 12. Mm-hmm.
Sweet.
Boom.
Aha.
Awesome.